So, Professor Savita, if you could introduce yourself, and then Chandana, if you could share your thoughts. I'm not able to see Professor Savita. Yeah.
Yes.
Go ahead, ma'am. Yeah.
Good evening. I'm Savita Rao, and as already mentioned in the WhatsApp group, I have been total working for about around 24 years. So my initial years were into banking sector, and then slowly I went into other areas like pharma, and also now presently I'm associated with teaching for almost around 12 years. And I'm based in Bangalore, and I teach the management students. We have a department of MBA. I also happen to be the head of Department of Humanities for the engineering students. So communication has been my major subject, which I've been teaching for the past 12 years, but the communication I teach is for the management students. And I'm also involved with scientific communication for the engineering students. So I have been associated with communication, and having done MA in English literature along with masters in business studies with HR specialization, it has been an area of interest. And organizational behavior is also another area which I teach the management students. So this has been on my mind for quite some time, because my daughter is a dentist, and when she was pursuing her master's in dental sciences, she used to come home and talk about the way they would interact with the patients and the kind of skills that is required when you're talking to patients. So that is when it struck me that probably, the people in the healthcare also need to be trained in communication skills, just like, people, we are training engineering graduates in technical English, management students in managerial communication, business communication, then why not the healthcare professionals? So this was there at the back of my mind. And but we didn't have anything like that in India, any course or anything. So I thought, okay, let me see what can be done. So that's where Dr. Arneja, you have come, and I hope I can carry forward the learnings and train people, especially the ones in the healthcare profession, so that they are better equipped to communicate not only with patients but also other stakeholders. So thank you all. Thank you very much.
Wonderful. I think that is the objective of this program. The whole program has been designed keeping in mind three things. One is the specific content that you require to deliver healthcare communication topics, because they are not like regular soft skills that we talk about. And second is the pedagogies that we are going to learn and discuss and share with each other, that can be helpful in engaging the audience in delivering the sessions, because conducting training programs in healthcare is not easy, because you really have to first create interest in the topic, engage your audience, and then deliver your content. So it's not like doing a program for any audience where you just go and do your program. So a lot of emphasis on the pedagogies that we are going to talk about, and then certain facilitation skills that we all require to conduct a training program. Some of you are already trainers, so you would be very well versed with the facilitation skills, but many of us are very good at clinical work or the actual work we are doing, but when it comes to actually conducting a training program, some of us are not really very well versed with the facilitation skills. So the whole program has been designed keeping these three major focus areas, and extensively we are going to work on it. So you'll be really very happy to attend the program. And I think Dr. Arjun will be of great help to you, because he's into dentistry and into management and into quality implementation and training dentists. So I think you'll make a wonderful association with him. So I mean, this is also a golden opportunity to network with people of your people who align with your objectives. So the forum is open for such associations also. Wonderful. Thank you so much, Dr. Savita, for giving your introduction. So Chandana,
Thank you very much.
Yeah, hello everyone. So I'm Chandana Bhuya. I'm a practicing psychologist and a psychotherapist in Guwahati, Assam. So I have been, interested in this particular area from a very long time. I'm following ma'am for a very long time now. Also because, my father is a doctor and he worked in state government, and I have seen from my childhood I have seen the conflicts between, healthcare professionals and general people. I have been a witness to many such conflicts. In fact, because I used to live in colonies, doctors' colonies. So that is one thing which makes me feel like, I should pursue this, because clinical communication is something which is very, very important. And also right now, I'm working in a hospital here in Guwahati, and the same experience is happening. So I can say that, from many years it has not changed. And Guwahati is a gateway to Northeast. So all the people come from different parts of the Northeast to here, and there is a huge crowd, there is a huge demand. So many things has been modernized, but nobody is thinking about working on this particular area. So that's why I thought that probably, this is my calling for now. I should learn this, and I hope I can take it forward with ma'am's
Definitely.
guidance.
Definitely. Thank you. Thank you, Chandana. So you'll be glad to know we have Navnita from Guwahati. She's from Downtown Hospital. So maybe two of you can work together and, have a breakthrough on this, because I know you all need to, work in collaboration with each other to really, make this subject a subject in the real sense. Yeah. So you can connect with Navnita and, see how you can collaborate together. Thank you so much, Chandana, once again for introducing yourself. So, friends, not waiting for, I don't know, we are just 10 of us. I think one more person is missing, but I'm not able to remember who is the person who's not here. No, I think it's Sharbano. Sharbano, is your camera on or what? Maybe she's logged out. Okay. So any questions about the last session? Anything that you wish to ask or say or give as a feedback after this session, which can help us improve the future programs? Anything? No questions? So when we have no questions, there are two things. या सब कुछ अच्छा था या कुछ भी अच्छा नहीं था. Okay, so assuming that you all, we are on the same page. I know a couple of initial topics, especially the first and second one, may sound very basic and very familiar to some of you, because they are required for people who are, who, just one second. Chandana, is there any problem at your end? Okay. So, so some of you may find the content very familiar or very basic, but then that's the need of the program, because all of us need to be on the same page. So kindly bear with me. And from session 3 onwards, we will be actually moving on to a different level of program. So the second session is all about developing communication competencies. So if I may ask you, do we really need a session on developing communication competencies? And how do you think this is going to help us in our personal, professional, or training programs? If you like to answer, you can unmute your device and share your thoughts, or if you like to write in the chat box.
Yeah, may I answer?
Sure, please. Yeah.
Yeah. So when we talk of communication competencies here, it is language is just a tool, I would say, when we talk about communication skill. So whatever language we may use, depending upon the, here it would be in terms of the patient, what the patient is able to understand. So it could be any other language apart from English. What is more important is the 7 C's of communication, which we have. So competencies in terms of giving the complete information, what we wish to tell the other person to understand, and see that it is delivered in a manner that is understood by the person, the recipient, you can say, like if I'm the sender and the other person is the receiver. So I need to put it in such a way that the other person understands. So I have to understand the perspective of who my audience is, who is going to be my listener. And from that person's perspective, I need to create my message so that it is easily understood and received. So that is the most important, part which we could say as competency.
Wonderful. Thank you so much. So I want to ask others to think and answer. How is this session going to help you actually? What do you think learning from this session will help you individually? Because it's very, whenever we are attending a program, we need to know why should I attend this? So how am I going to be benefited? Although all of you are excellent clinicians and trainers and team worker, but then how will this session really help you?
So,
Anuradha, yeah,
yeah,
Dal,
sorry.
yeah.
So
Please.
what I feel personally is communication is one, it's so much ingrained in ourselves, and that a lot of time uh, we have to go outside and observe ourselves. It generally happens as if you record yourself speaking and then watch again that, okay, acha, main aisa bol raha tha, or this is the way I communicate. And then you start realizing that, okay, it has become so natural to me to behave in a particular way, to communicate in a particular way, that it is very difficult to identify, first of all, that I need to develop this competency of a particular nature and add on in my communication style. So I think as an individual, first it would help us to realize which competency, which is our strength, what are our weaknesses, where do we need to act as an individual also.
I think you have really touched a very, very important point. Usually we say, okay, it's how do we communicate with others and how do we talk to them, but then introspecting and reflecting on the way we communicate is very important. And I think one of the objective of this session is this is going to help you, freely introspect and also share your thoughts about it. Because unless we let go that inhibition that, oh, I speak fast, or I am not good at vocabulary, or my tone of voice at times become very harsh and rude with my juniors, that's the first point where we need to really, pause and think, okay, I need to really work on this. So in the last couple of sessions, with the other batches, people, very senior people have come forward and said that, oh, I didn't realize I use very harsh tone with my juniors. Thank you for pointing out that to me. So wonderful. I think that's one reason why we really need to, understand the nitty-gritties of, communication, because at times we think we speak so well, so why the hell do I need to learn it? So personally, individually, this is going to help us. Second, I think Dr. Sheher Banu has written a wonderful this thing. It is to learn how to communicate with our patients and colleagues. Very important. I think it's very important that we learn the right way of doing it, because what we do, we think that's the only way of doing it. But through this program, hopefully we'll be able to learn different other ways that could be equally effective or could be even, more effective than them. And Dr. Amreen says, yes, it's definitely required, as life is nothing without communication. Completely agree with you, Amreen, because that's the truth of life. We don't realize all our awake time we are interacting. So even when you are not talking, you are just listening to me, even then you are communicating. So that's the amount of communication we all do. And then Sherbanu has written, there are some small points that we do not care about, and that's what is forgotten. But if we forget, that it may cause many problems. Completely agree. And I think this is the purpose of this session. We are going to take your attention to the finer details of communication, and you'll really enjoy this session, because it's not going to be a theory session or preaching. You're going to do it yourself and see how we miscommunicate or we communicate wrongly. Dr. Anuradha, you want to say something? Please go ahead. Yeah.
Ma'am, I wanted to say, but most of the points are covered. The only point that I wanted to say was sometimes we know the content, that what is exactly to be communicated in a topic, but then how to communicate is where communication competency would come. And this is a master trainer course. Many of us might be knowing that this is the healthcare communication part, which is needed by the healthcare staff, but then how to give it to the staff, how to make them understand is the point.
Is the point. Thank you so much. I think that's another wonderful point. So if I may summarize our discussion about why we need to have this session, one is individually, personally, I think we'll be able to introspect on our communication style. Second, we will also learn how to go about communicating with the patients and public in general, because many of us are in public dealing and patient handling. So we really need to know what is the right way of handling and interacting with the patient and their family. And third, very important is, if some of you are, or rather all of you are thinking of being a trainer, then how important this is a topic as a training topic that you will get to see when we will have a discussion around it. And then how do you go about delivering it? Because you are going to see how we are going to conduct the whole session. So it's a metacognition. It's not a cognition, it's a metacognition, observing how we are going to actually do it when you will be doing your individual program. So you also have to observe that it's not going to be a theory session. You have to actually make it very interesting, very engaging. Only then your audience will listen to you and agree with your point of view. So I think with this background, let me quickly share the screen with you and share some slides and then go ahead with the session. Give me 1 second. Is the first slide visible to all?
Yes, ma'am.
Okay. Okay. So any idea what percentage of our success and happiness comes from our communication competency? Just guess.
70.
Okay, good guess. Anybody else? Good guess.
100.
Oh, 100. जहाँ पे काम ही सिर्फ बातों का हो, then I think it's fine. But then you do require.
78.
Sorry?
78%.
78%. Okay, very precise. I think you are going very close to the estimate. So it's just an estimate. It's not like any specific value, but a study was done by Harvard University. And they realized that 85% of your personal and professional success comes from your communication and interpersonal skills. So that should tell us how important it is to develop communication competencies, which at times we take very, very lightly, and we don't take them, really. I mean, we don't pay much attention to developing these competencies. We normally assume that I know it all and I can manage it very well. But let's understand, what do we really mean by communication competency and how can that be really improved? Now, what do you see in this picture?
An angry man.
Okay.
Shouting at someone.
Shouting at someone. Any other thoughts?
Man who is trying to make the another one who's talking with him in phone understand, but he cannot make him understand.
So that appears
That's why he's angry.
He's angry, agitated, very frustrated. He's literally shouting at that person. I completely agree. See, without even a single word, you could guess so precisely about what could have been happening in this picture. And that's exactly when people interact with us, even if they cannot see the words or cannot hear the words, that we are having as an inner conversation. From our appearance, from our facial expression, from our body language, they are able to guess and estimate how keen are we to interact with them. How happy are we to interact with them? Especially in healthcare, you may have seen a lot of time patients and their family members come back and say, I mean, I didn't find your staff very welcoming, very forthcoming. Although your staff would be doing their duty very well when it comes to giving medication or injection or looking after the patient, they will do everything very meticulously. But there is something that is missing, and that's actually the body language, which probably they do not care much to really correct or mindfully align with the requirement of the patient. 93% of the communication is non-verbal. I'm sure you all know it already. But interesting part is 55% is the body language. We normally pay a lot of attention to the spoken words. And I don't say they're not important. They're very important. But actually, when it comes to transmitting a message, words have just 7% of impact or value. We all communicate through 3 ways. Language, we all know, we use words. Then there's para-language. And then there is body language. Now, if I may ask you, what is the percentage? You have already seen this slide. But if we consider it equal, then that means each portion should contribute at least 33%. The language, paralanguage, and body language. But how many of us are really mindful of paralanguage and body language? That's a question to be asked. Now, when it comes to language, we all know it's all about words. My question to all of you is, do words matter? What do you say? Do words matter?
So, ma'am, words matter, but the connotation can, I mean, it depends on the body language and also the tone, voice. I mean, that decides the connotation of the word.
Very true. Thank you, Chandana. So let's do a small activity and see how do words completely change the connotation and context. Okay. So what we'll do a small activity. Assume that we are going to discuss about outreach camp, and we are all together in that meeting. We are all members of that group who are discussing about the outreach camp. And each one of you is expected to share your thoughts, but how you start your dialogue will be, yes, I agree, but. Okay? So I'll give an example and I'll start the discussion and I'll pass on the baton, and then you have to pass the baton to the next person. Okay? Okay. Yes, I think the idea of outreach camp is really wonderful, but I have a lot of pending work. I don't think I can make it. Dr. Kunal.
Yes, I agree that there is a lot of pending work that you have to complete.
No, not me. You have to now tell your this thing. Yes, I like to go, but you have to give the reason why you think it will not be possible for you.
Okay. Yes, I agree the idea about the outreach camp, but I think it is not necessary to have this camp at this particular village because they already have medical facilities with them.
Whom do you pass the baton?
Dr. Anuradha.
Yes, I agree with Dr. Kunal and Dr. Indu that outreach camps are important. But I have attended many outreach camps. Sometimes we go and there are very less or no patients, so it's a wastage of time. I pass it on to Dr. Arjun.
Yes, I agree. Outreach camps are required, but considering the additional manpower required to conduct the camp, it is not feasible option. I pass on to Dr. Tanuna.
I agree about the outreach camps, but we will have to see how useful they really will be to the community and plan it accordingly. Dr. Amreen?
Yes, I agree that the outreach camps are important, but we also need to look after the infrastructure and resources we need for those camps.
True. Whom do you pass the baton?
Navneeta.
Yes, I agree that outreach program is very important. But before doing that, we have to plan it accordingly and we have to see our resources and we have to also look after that whether it is really feasible or not.
True. So whom do you pass the baton, Navneeta?
Chandana ma'am.
Hi, ma'am, I'm not able to switch on my camera. Is that okay for now?
It's all right in case if there is really a challenge, but otherwise you will miss the visual input.
Yeah. No, ma'am, I'm changing my network actually. So I agree with your idea of outreach program, but I think we need to do some amount of survey and studies before starting the program.
Whom do you pass the baton? So we have Dr. Savita,
There,
Dr.
Banu ma'am.
Savita ma'am. Savita ma'am is left, I guess. Yeah.
Yeah, Savita ma'am is left.
Thank you. I agree that the idea of an outreach camp is wonderful, but at this point of time, with so much of COVID happening all around, I don't know whether it is going to really work out.
Wow. Agree, completely agree. So whom do you pass the baton? I think we are left with two people, Dr. Shehrbano and Dr. Shafaz. We are not able to hear you, Dr. Savita. Unmute your device. Okay, I think I'll ask Dr. Shehrbano to go further. Yeah, Dr. Shehrbano, please go ahead. Yeah.
Yes, I agree with the idea. Your idea is very good. But if you think once more that about resources and how benefits it will be very good. And maybe you will have much more better ideas instead that outreach camp.
Very true. Okay. So Dr. Shafazo, what do you say? Please unmute your device.
Yes, I agree that the outreach program is very important, but the ideas are very beneficial.
I didn't get the last line, but it's okay. I understand she's said some reason after, but now let's do another round of discussion about the same outreach camp, but with a different word. The word will be, yes, I agree with the idea of outreach camp. And I'll give you an example. I'll start the discussion. Yes, I agree with the idea of outreach camp. And I will definitely send at least 2 of my staff members to help you with the program. Dr. Kunal.
Yes, I agree with this idea of outreach camp, and I'm sure it would be a wonderful experience for our team as well, how to work in the rural areas.
Wow. Dr. Anuradha. The same cycle we will. Yeah.
Okay. Yes, I agree to this outreach camp. And I think even if patients don't come, going will only make a difference. Patient will at least know that people are there to serve them, and maybe next time they will come.
Good idea. Dr. Arjun.
Yes, I agree that with the outreach camp, and I will definitely look into the resources and then decide upon.
Thank you so much. Thank you. Dr. Tanu.
I like the idea of outreach camps. It will benefit people and they'll be able to get healthcare at their doorstep. We will just have to organize the resources accordingly.
True. Who else? Who is left? Amreen, after that?
Yes.
Yeah,
yes, I agree with the camp. And I'm sure definitely the community will get benefited with this idea and they will get the services they are seeking for.
Okay. Who's next?
Chandana ma'am.
Yeah, I agree with the outreach program. And I think it is a very wonderful idea also because highest amount of mob creation happen in rural areas and due to conflict with healthcare professionals. So I would love to personally also participate and, supervise and learn more things about it.
Thank you. Thank you. Who is next?
Navneeta.
Navneeta, go ahead.
Yes, it's very good idea. Definitely, it's a good idea. So I think we'll be able to help with our team for this program, and I think it will be a successful one.
Wonderful. So who is next?
Shehrbano ma'am.
I think Savita ma'am.
Okay, I agree with this outreach camp, and I'm going to ensure that it gets as wide publicity as possible so that we can have a lot of people joining us.
Thank you so much. Thank you. Wonderful. So Dr. Shehrbano, what do you say about the camp now?
Yes, I agree with this camp, and it will be a good experience for us, and we can learn much more from rural people and rural areas as well.
Wonderful. Thank you. Dr. Shifazo, what do you say?
Yes, I agree with this camp, and it's very important to take idea and experience uh, for benefit the people.
Thank you so much. Thank you. So, what difference did you see in the two discussions we had?
But
By replacing,
Sorry?
by replacing the word but with the word and, it totally converted it from a negative to a positive.
Just one word could change the complete energy of the group. Can you see the ideas coming, the resources coming, contribution coming? And unfortunately, many of us have this habit of using but too often than required. And you will see this happening in meetings. There will be few people who will always have a but. And they'll always have a but before everything. And they'll put their butt everywhere.
That is not true.
And they'll not let your project move. So we really need to introspect. Am I using this but more often than required? So this is just one small example of sometimes the wrong words that we use too often that spoils the complete work culture of the place. I'm sure there may be many more such words. So just give it a thought and let me, know, write in the chat box, normally, what are the common errors we make in the language while interacting with patients, their family members, and junior colleagues? Why I have written specifically these three things? Because with seniors, we are mostly very cordial, very respectful. So there we don't make any mistake. We know what I can say and what I cannot say. Very rarely we would fail on that front. But these are three places where we normally take advantage, take them for granted. So write in the chat box, what are the common errors we make in the language while interacting with the patients, their family members, and our junior colleagues? Okay, we don't respect the feelings of the family, their concern and anxiety. Agreed. But can you specifically, Amreen, tell few words that we do or some behaviors that we do that clearly shows our verbal communication not very cordial towards them? You're right, but can you specifically identify some words? I don't have time. I have a lot of patients. Yes, very right. When we say this to the patient, what do we really mean to communicate? I don't care for you. I don't have time for you. We act as if we know better than them. Yes, we do that. I know it all. How dare you try to teach me? We think that patient sickness is nothing serious, and we say, okay, that's nothing, and patients think you are not taking him or her seriously. Absolutely right. I completely agree. When we say something like this, they have a feeling that our problems are not being taken seriously by the how about juniors? Sometimes the juniors, how do we talk? We use a lot of medical words. Yes, Kunal, Dr. Kunal, very right. But unknowingly, we use the technical vocabulary that patients may not understand, and then at the end we realize there's a lot of confusion in their understanding. I completely agree. Yes, you use a lot of technical jargons. Speaking is a matter of fact manner without considering that we speak in a matter of fact manner. We lack empathy. Absolutely right. We forget to understand their situation and just clearly say what is to be said. Yes, that means we are too matter of fact in our approach. Okay, patient is serious in front of. Can you explain it, Dr. Patanu? Patient is serious in front. I mean, I'm sure you have a message behind it.
Yeah, what I'm saying is that sometimes when we are talking about patient's condition in front of the relatives, we forget that the patient is also there, and how is he going to be impacted?
Exactly. So how
we
Yeah. Agreed. Completely agree. So we act like we don't trust on our diagnosis and treatment. It makes patients to be in the doubt also. Yes, I think some vocabulary we use sometimes when we say, I don't know, or I'm not a God. Even I need to find out. So when you use such words, patients would get confused that how much do we really know about the patient's condition. I completely agree. With juniors, you may have seen a lot of times seniors would use words like tu and tum. If I'm talking about Hindi, I'm sure in English we have only one word, that is you. But in Hindi, very often we have seen seniors using the word like tu and tum. Have you seen this? And those of you who are
Yes.
junior or who have been junior and who have heard this word, how did you feel when you were addressed like this? I'm sure not good. Even kids today point out when you say them tu and tum, they say, "Mummy, aap tu करके कैसे बुला रहे हो?" है ना? They would say, "How can you use this word for me?" So that means they are so sensitive to the idea that we need to be respected. But when we use the same thing with our juniors or with patients, they feel bad. Or the thing is, they are not able to voice their feeling. So at times we become disrespectful by using tu and tum with them. We are at times rude, authoritative, and uncourteous when it comes to using the language. क्यों खड़े हो यहाँ पे? क्या मतलब है आपका? क्या चाहिए आपको? So I mean that's not the way the patient and their family members would expect us to, address them. We even sometimes forget to use basic courtesies like thank you, excuse me, you are welcome. How many of us say excuse me in case if our phone rings and if we pick the call in front of the patient? I haven't seen anybody, saying, excuse me, I need to take this call. Can you wait for a minute? And suppose if the patient gets a call in our presence, we literally shout at the patient and say, "Aap band nahi kar sakte phone ko, bahar jaake baat kariye." We literally shout at the patient. So the basic courtesies like, excuse me, you are welcome, thank you, we don't offer to our patient, not that we don't know, but we think they don't deserve. And then at times we use, we snub them by using foul language. I remember one of the doctors shared his experience that he had sent his father-in-law to a senior colleague who was very good clinician, but he was doubtful about his behavior, but he was very disappointed when he said. So this attendant asked a couple of questions to the doctor, and the doctor said, "Doctor, मैं हूं या आप हो? आप यहाँ पर इलाज कराने आए हैं या मेरी knowledge check करने आए?" So when you snub your patients like this is probably the foul use of the language. So a lot of us do this mistake, and you must have seen this, in when the front desk staff, nursing staff, residents, and other healthcare providers, they interact with the patients and they fail on this front. And then sometimes in the name of assertion, we become rude. A lot of us think that I assert, which we are going to discuss at length in 2 sessions in the time to come. But a lot of us think being rude and aggressive is being assertion. And that's also somewhere we need clarity about. So in language, I think this is a very common mistake we do. Can you think of anything that I missed here?
Many times we snub someone by not by watching at our mobile phones and talking with someone.
Yes.
So we call it fubbing now, but we do it a lot.
Yeah. So we in government setup, you can say, like for example, when I used to ask these doctors working in government setup that in case if patients talk things that are not relevant, so how do you stop them? So they would give examples to the extent that they would say, ज़्यादा कहानीबाजी मत करिए, जो पूछ रहा हूं सिर्फ उसका जवाब दीजिए, आपकी फालतू बकवास सुनने के लिए नहीं बैठे हैं. And of course, in corporate sector, we cannot answer like this. So there, Dr. Kunal, we use techniques like we start, writing something, or we start looking at the phone, or we start moving away. But that's another way of ignoring the patient or not being cordial to the patient. So that was about language part. Paralanguage. What is paralanguage?
Paralanguage is anything that adds,
Tone and
should you say, supports the main language. So when you look at, hello, so when you, examples are the pitch, the tone of the voice, and they are like the intonation, the voice modulation, the way we are using should you say the other aspects like of our voice quality,
So
whether how loud or
language
how
is
soft
words,
we are talking.
language is words, and paralanguage is how these words are delivered.
Yes, because the meaning of the word can change in the
Language is
way we
words.
use paralinguistics.
Exactly. So pitch, volume, rate, quality, intonation, everything is part of paralanguage. And communication is not what we say, communication is how we say. 10% of the conflicts are because of the wrong words. 90% of the conflicts are because of the wrong tone of voice. Even if you're saying the right thing, but if your tone of voice is rude and authoritative, people will say, "Aap baat kaise kar rahe hain? Is this a way to talk?" And you must have seen this very often in the healthcare setup. For example, take this one sentence. I've written the same sentence 6 times. Put little emphasis on the word that I have highlighted and underlined and read this sentence. I give you 30 seconds to read this. So, Dr. Tanu, what difference did you see every time you read each sentence with emphasis on different word?
The meaning and actually the question changes every time. I mean, first time, whether you did it or not, whether you did it or somebody else did it, then did you give her or did you not give her? So it changes every time.
So imagine, just imagine. So I saw a caption, "I will see you soon." And I saw a blood dripping from those words. The whole meaning was very different. The tone of voice completely changes the meaning and intention. That actually tells about the intention. Roko mat, jane do. Roko mat jane do. The complete meaning changes with the pause and the tone of voice. That's one thing we usually fail on. Let's accept. Now, next time you talk to your juniors, your housemates, your kids, your patients, watch your tone. You will get to see, unknowingly, we become authoritative, sometimes rude, sometimes arrogant. And 38% of your communication is through your tone of voice. Tone of voice. The same sentence said differently can change the complete intent and meaning of the dialogue. So very important, check your tone of voice, and especially when you're doing this program for your staff, ask them and tell them what are the inappropriate tone of voice. For example, if the patient asks something and if we reply in a casual manner, especially if the staff on the front desk staff or the nursing staff who is dealing with the patient directly, anywhere if our tone of voice is casual, patients feel that we are not taking their problem seriously. Ma'am, doctor kab aayenge? Aa rahe hain, baithiye. You can see the words and the tone of voice. That means I'm just asking you to get away. Or you look disinterested and unconcerned. मैडम उसको बहुत दर्द हो रहा है पेट में. हाँ बोला है डॉक्टर को देखने आ रहे हैं. Again, that shows that you are not affected, you are not concerned. Inconfident. If you are not sure of your whatever you are saying, that will get reflected in your tone of voice. So we have to be very careful, and confidence will come from knowledge. Subject knowledge, communication, and your willingness to interact with the patient. So anywhere if you're lacking any of these three things, your tone of voice will show in confidence. And then of course, anytime we become rude and authoritative, public dealing, it will really fail you. And then of course, we become aggressive. A lot of us have the tendency to lose control very easily. Not that we become aggressive right in the beginning. We are calm in the beginning, but we are not able to hold that calmness for very long, and very quickly we become impatient and rude. For example, if the patient has asked 1, 2, or 3 questions, fourth time we'll say, that's all, I don't have time. Or you may talk about it in the next visit. That clearly shows that that's not the right way of doing. So the appropriate tone of voice is every time, especially in public dealing, every time you're talking to somebody, patient or their family member, we need to sound sincere. If the patient comes and says, I have come to see Dr. Anand. So I won't say Betty. I'll say, okay, let me see your card. And I'll see the appointment time. And then I'll check the availability of Dr. Anand in case if it's a polyclinic or a huge hospital and a lot of doctors are there in the OPD. And then I'll come and I can check my even appointment register. Yes, your name is there. I'll call you. Please be seated. So you have to sound sincere. Patients talk about their problem. So we got to, through appropriate tone of voice, we have to showcase that, yes, I understand your concern. The patient says कि मैडम उसका IV खत्म हो गया है, so I won't say आते हैं, okay, 2 minutes में देखती हूँ. So we have to sound responsible, confident, with knowledge, with communication skills and concern, soft and polite, and at the same time assertive. We are going to talk about assertion in length because that is one skill I would really want each one of to be thorough with, because you need to practice it yourself and you need to really transfer it to your audience. Especially in public dealing, that's the only way to align your patients with you and the only way to prevent aggression and violence against you. If anybody can learn assertion in the right way, you can manage any situation. So tone of voice plays a very big role, and I think we really need to check the tone of voice we use with different categories of people. I'm not saying that we use the same tone of voice with everyone. We are very selective. We know with whom we can be rude. So we got to be careful not to be rude with those who are nice, but they have no say, especially when it comes to patients or their family members. At times we take them for granted and we become rude and authoritative with them. So in general, I think in public dealing, we need to be soft and polite, but at the same time, we should be audible. Many of us are not audible. Your patient may not be able to hear what you're saying. There are 2 possibilities. One is they may just not ask you once again, fearing that you will be upset, or they may request you, Doctor, samajh nahi aaya, dobara bataiye. And the moment they'll say, dobara bataiye, what will happen to you? Will you feel like answering? Most likely, it will be visible on your face that you are irritated. And especially if the 3rd time he says, Doctor, ye samajh aa gaya, ye dobara bata dijiye. Gone case. You will lose your patience completely. So being friendly, I mean, I'm talking about the voice modulation. Voice has to be friendly, confident, and non-aggressive. Again, I'm repeatedly saying non-aggressive because with the patient and their family, being aggressive is not the way of life. We are here for them. We need to understand that they are the one for whom this whole system has been developed. They are part and parcel of the team. And we at times act aggressive as though they are burden on us or they are liability. So we really we need to let go of aggressive tone of voice. Another one thing that we have to be very careful about is avoid using high pitch, high tone or shrieking and shouting in public place. That is one of the reasons when you can expect violence against you. And I want to give you an example here. Now, for example, take a situation where there's a patient in the OPD and the patient is not acting very sensible, is rude or misbehaved or aggressive. डॉक्टर साहब आपका हॉस्पिटल बेकार है, इतना पैसा आप ले लेते हो और कुछ भी नहीं सर्विस देते हैं, घंटा हो गया बाहर वेट करते हुए, पानी भी नहीं है, what a useless hospital, and you are very unhappy with the way he is behaving. Now situation 1, patient is misbehaving, but you are calm, confident, cordial, and very direct in your communication. In this situation, there are people who are bystanders, who are listening to your conversation, overhearing your conversation. Whom do you think the public will align with you or with patient? I repeat, Patient is being rude and misbehaved, but your behavior is very cordial, calm, confident. You're handling the situation in a very mature manner. But the patient is misbehaved. There are people standing around you and overhearing your conversation. Whom do you think the public will align with? With you?
With the doctor.
With the doctor.
Doctors.
With the doctor?
Initially, in actual situations, what happens is when one of the patients starts complaining, the rest of the people also start adding to their complaints and they join the bandwagon and everyone becomes on one side.
Wonderful. So that's a third situation where there are a lot of grievances and complaints that we have not addressed to, or there are certain patients' requirements that we have not really addressed to. So there's a collective, feeling that we are not acting responsible. That's a situation, third situation. The situation that I'm talking about, it is one-on-one interaction with the patient, and there are a couple of people standing, 2-3 people, just observing. But you are handling in a very, very calm and mature manner. But the patient is not behaving right. Chances are public or people who are standing would align with you because your behavior is exemplary. Take another situation. Patient is acting aggressive and so are you. Patient is saying, you have a useless hospital. Example, it's a government setup. You have a useless hospital. I asked one of the doctors, if patient misbehaves, how do you handle them in the OPD? So he said, I literally tear their OPD slip and I say, get lost. I'm talking about the government setup. I know in the private, we can't do that. If the patient is acting aggressive, and so are we, now whom do you think the public will align with?
Patient.
Patient.
So a very smart thing that we have to remember, people in public dealing should have good temperament. Please remember, if you are into placing people, make sure people who are into public dealing, they should have good control on their temper. That's one thing. Second is, they should be trained to handle aggressive patient party. We are going to talk about it. We are going to take this as one of the topic in the time to come. Third, they should know when to escalate. In case if they are not able to handle the situation, they should clearly know when to escalate. And they should be clearly told, never get into any argument at a public dealing place. You are going to lose the game. Aggression fuels aggression. The only way to handle aggression is assertion. So please make sure that you train your staff at the front desk or wherever there is public billing, even billing, at the billing or pharmacy or lab and radiology, because there's a lot of workload. So people are likely to lose their patient and become aggressive. You are unhappy. For example, if I'm a lab technician, I'm unhappy because I have done 100 tests since morning and I'm tired. But this patient who has come to me is tired and exhausted and unwell and has visited number of places and has come to me. We are trained healthcare professionals. They are not trained patients. So we need to train our staff to learn to deal with such adversities. They are occupational hazards. So aggression is an occupational hazard because emotions are high, people are unwell, they are exhausted, tired, financially drained, and what not. They may have suffered before reaching to us. So I can't say I've done 100 patients, so I'm not going to do it for you. Or you'll have to wait for another 1 hour. I'm sorry, I will not attend to you because I'm very upset. Mindfully, we have to train each healthcare professional to learn to stay calm and handle the situation amicably. So in public places, I think we really need to put people who are calm in nature, mature in their public dealing, and also who know how to handle the situation. And in case if they are not able to manage, what is the way to escalate it to the right person? But in general, I think one thing that you have to clearly tell, there is no chance for any high-pitched, high-tone voice in public place. That's the first step towards controlling a situation. Another important thing that we have to remember is to regulate the speed of talking to the understanding speed of the patient. One, because when we are talking about the medical jargons, they don't understand, especially when you're explaining them about their diagnosis or their treatment or intervention or the aggravation of condition or whatever, or deterioration of condition. So that's all little technical. We'll be talking about that part again in the next few sessions. But in general, I think we have to remember the speed of talking should be always matched with the understanding speed of the patient. In general, this is my personal view, and I've found it very useful. When you speak slowly, your impact improves multiple times. Why do we like Amitabh Bachchan's voice? One is, of course, because he has a husky voice and all good quality, this thing. But one of the reason is, if you look at the speed of his talking, it's slightly lesser than the normal speed, and that increases the impact. So in public dealing, if you can bring this change in your speed of talking, and even otherwise in your personal life also. Another one benefit of speaking slowly that I have experienced is you are able to choose the right word before you utter it. Because if you speak at a speed, then whatever comes, you would just deliver. But if you speak little slowly, and you try doing this and report me in the next session, especially those who have habit of speaking faster, try doing this. I've done it for myself, and I found it very, very, very helpful. And also, when you're speaking at a speed, your rational mind is not able to check what you are saying, because that becomes more like an automated delivery. The moment you will slow down, your rational mind will tell you, stop, don't say this, not the right word, not the right time, not the right person, not the right way. So these are the benefits of checking your speed of talking and get the benefit of, it could be in your personal relationship, professional relationship, or even in training programs. It has a huge impact. It is a huge impact. In public dealing, a lot of time you will have to say no. And genuinely, you will have to say no, not because you don't want to help, but there are some protocols, some policies, some procedures that you need to follow, whatever the hospital has designed. But because you are the front man, so you have to say no. Then we have to learn to say this no in a very, very, right way. And that's all about assertion. Assertion, we are going to talk, and probably this will be taken as one of the complete topics in one of these sessions, where we'll talk about how to handle aggressive patient party. So we'll talk at length, and you will get to know your communication style. I'll be giving you a questionnaire to answer. You'll get to know what is your primary communication style and what is the right way of communicating. So that will be an interesting finding for all of us. But in general, I think we have to remember this is one skill we all lack. And those of us who have it, they are able to deal with any situation. And especially if you observe people who are able to deal with difficult situation, you will see that they have wonderful assertion skills. Not that they get scared of the public or patient, but they will say things in such a manner that makes sense without creating any unnecessary hurt or insult to the patient party. So this is one skill we all have to learn. Now, part 3 is body language. We have talked about language, we have talked about paralanguage, and part 3 is body language. So body language, we all know what all comes in body language. Amreen, what do you think? What all comes in body language?
Our gestures while talking to the patient and how we are responding to them.
Mm-hmm. So everything from head to toe is part of body language. Everything from head to toe is body language. And we have discussed this, that 55%, a major part of it, is through body language. And trust me, we are not very mindful of body language. We are not even aware. Some of us are not even aware how is our body actually communicating. So when I say head to toe, it could be your facial expressions, eye contact, gesture, posture, even touch. And the space we maintain with people, that's all part of body language. Even the time, your time and others' time also is part of non-verbal communication, and we'll be discussing that in brief. Yeah. So I've shown you a picture here. What are usual facial expressions we have when we are interacting with the patients or their family member? 1, 2, 3, 4, 5, 6, up to 9. Which one? Write in the chat box, according to you, which is the usual facial expressions we have. 4. Okay. 5, 5. Some more? 1. Yes, 9 o'clock when we start our day. I agree. Okay. 2. Okay, excited. Sharvano, very good. Very nice. Tanu says 1. Okay. How many of you have really seen doctors and healthcare providers smiling and welcoming you when you visit their hospital? Honestly, raise your hand. I want to see. I haven't seen, honestly. Unless the doctor really knows you or the staff really knows you, then they say, oh, welcome, welcome, aajo, aajo, aajo. But otherwise, yes, what can I do for you? Your expressions are usually number 5. And what is on number 5? What is on number 5?
A very grave face.
No expressions.
No expressions. Actually,
Flat expression.
Flat expressions. And why do we keep these expressions? Dr. Kunal, what do you think? Why do we keep these expressions?
Maybe we are trying to say that we are quite knowledgeable, quite serious, and we don't want to reveal, we are not very friendly. Yes. So maintain a distance with us as a doctor.
I think I agree with you. What about others? Any other thought? Dr. Tanu, what do you say? Why do we keep this expression, number 5? Please unmute your device. Dr. Tanu. Yeah.
Probably because we don't really care how we present ourselves to others.
Agree.
So that
Wonderful.
is why.
Wonderful. We are not mindful of it. That we need to smile with the patient. Dr. Arjun, what do you say?
Maybe just want to be neutral, not positive, also not negative.
Okay, so I don't want to be friendly. I don't want to be negative. So I'm keeping this expression. Dr. Shifazo, what are the facial expressions you see in the hospital, among different healthcare professionals, doctors, nurses, front desk staff? Is it number 5 or something different?
In my hospital, the second number.
Very good. all your healthcare providers, all team members?
Most of them.
That's so good. In case if you are able to create that culture where people are welcoming, I don't disagree completely that no, that's not possible. But I'm talking about most of the places. Most of the places, especially when we interact with the corporate hospital, management, they say staff would do everything. They would do everything, but they would not smile. They would not welcome. They would not be happy to, be friendly with the patient. Navneeta, what is your experience? Do you agree with what I'm saying?
Yes, ma'am, I do agree. Maybe this expression is due to just to avoid the unnecessary conversation with the patient.
So the real reason is, you're right. The real reason why we don't smile with the patient, because we don't want to be friendly with the patient. We think if I become friendly with the patient will try to take secondary gains from me. So we have a face or expression that's like unwelcoming, unfriendly, neutral. I get sometimes answers from my audience. We don't smile Otherwise, patient will think we are laughing at the patient. And I think that's a
True,
very...
that is also true.
I'm sorry, I couldn't get who is answering.
It's me, Savita.
So
that
Dr.
could be
Savita,
like yeah, the reason could be, see, I was listening to all the other responses, and yes, they are right. But then it could also be like probably they do not want to give too much of
Dr. Savita, you will... I'm
the
not able to
patient
hear.
shouldn't have too much of high expectations. So maybe they are trying to be a little more cautious while dealing with the patient and waiting to get to know the patient before they actually open up. That could also be a reason.
That's all right. Only thing is, see, saying this, I don't smile because otherwise patient will think I'm laughing at the patient, is a very, I mean, not agreeable reason. Why I'm saying this, we are sensible not to smile at a wrong place or at a wrong time. For example, if a patient has come in the emergency with the cardiac condition or after an accident, no fool will, I mean, smile or laugh at the patient. We know the seriousness of the situation and we would maintain the decorum. But in general, when everything is okay and there's no need to be rude and very, unfriendly, and where we know being friendly or being smiling can change the milieu. We need to really know. Yeah, please.
It can actually be a sympathetic smile when you talk to the patient.
Yes,
that would be understood.
Exactly, that's what I meant. Welcoming, yes, that I am happy to serve you. I'm glad you are here. I think that's what we are looking for. So, very important thing to tell the staff or your team members is to welcome your patient with a smile on your face. When we go to another hospital, somewhere whom we don't know, we expect people to smile and welcome us. Facial expressions like anger, irritability, unhappiness, attitude, they are all very well shown from our facial expressions. Patients are able to read it. They can really make out how we are feeling inside. Okay. I was going through, something very interesting, and I found it, smile, importance of smile, it can really, really change the complete milieu. And let me show you something very interesting okay, I need to... Give me 1 second, I'm sorry. I need to locate where we are. Are you able to see my screen?
Yes.
Okay. So this, I'm going to show you a collection of pictures. This is taken by Jay Mainstein. He's an Australian born wanderer, and he has sent these pictures on a group. He said just this word smile completely changed the picture that he took. And here we go. And we all keep usually the first face and see the difference in their appearance, in the energy. Now, how many of you really agree with the importance of smile?
I think all of us.
How many of us really use smile as a regular way of connecting with people? That's a question to be asked. So next time you meet your patients and your team members, have a smile. I think that has to be part of. Just recently, I think we received a message. I mean, I'm sure all of you must have seen, because on WhatsApp you get everything spread so quickly. Is it in Denmark or Philippines that the door will not
The restaurant open till you smile. Yes.
You smile. That shows how we have completely forgotten to smile. I mean, we consider smiling as a very unnecessary gesture, whereas smiling immediately relaxes the milieu. You feel so connected with people. You feel so, comfortable with people. I think that's one thing we have to really. This is such a small thing which you can, initiate in your setup. When you meet with your staff, patients, their family members, smile and talk. And we know how much to smile, where to smile, and what is not the right place or which is not the right occasion to smile. I think we're all very, very well versed with.
And it is contagious, actually.
Yes, very true. It's contagious. The moment you will smile, you will see the other person immediately smiles back at you. I think I use it very often, and I find it very helpful in breaking the ice and making everybody comfortable. Everybody, comfortable. So it is not only important to, be mindful of your facial expressions, but it is equally important to be able to read others' facial expressions. Because a lot of time patients may not say you anything verbally, but if you know how to observe their facial expression, you will know that there is something the patient wants to say or has something to share with. So let's do a small quiz to see how many of you can actually read the facial expressions. Let me see if it works. Wow, I think I've. Okay, so can you see the facial expressions? And the
embarrassment. Embarrassment.
Embarrassment. Fear, sadness, surprise. Which one?
Embarrassment.
Embarrassment.
First one.
Okay, there we go. Answer is fear. Answer is fear. Okay. Okay. Now this is flirtatiousness, interest, happiness, politeness.
Happiness.
Interest.
Politeness.
Politeness. So there's a controversy now. Which one do you want to say? Because I'm not getting majority on anyone. So which one?
Interest, I would say.
Interest.
Politeness.
So how do we know how many of you want? So shall I go for interest or politeness? How many of you say interest? Raise your hand. One and two. Okay.
Only one.
Two people. No, Dr. Savita also agrees with you. And others are saying politeness. How many politeness? Okay, let me quickly do it. Interest. Let's see what is the right answer. Happiness.
Happiness.
Okay, next question. Now be a little careful. Think and answer. Sadness, pain, anger, disgust.
Anger.
Okay, anger.
Sadness.
Pain.
Anger.
Anger.
Okay. So we have had just one correct answer out of three. Okay.
This is embarrassment.
Sadness, amusement, shame.
Embarrassment.
Embarrassment.
Embarrassment. Okay, I go with you. Embarrassment. Correct. Very good. Now we are becoming pro at it. Okay. Pride, contempt, excitement, anger.
Pride.
Contempt.
More pride.
Right.
Okay.
Yes.
Contempt.
Okay.
Right.
Pride. Correct.
Pride. Oh.
Okay. How about this one? Fear, interest, surprise,
Surprise.
compassion.
Surprise.
Surprise.
Yes. Correct. Slowly we are becoming pro at it. Sadness, shame, disgust, contempt.
Disgust.
Contempt.
Shame.
Mhm.
Disgust.
Contempt.
Disgust.
Probably.
Disgust.
Disgust.
It's
How many of
disgust.
you say disgust? Raise your hand.
Contempt.
कुछ लोग कहीं भी हाथ नहीं खड़ा कर रहे हैं. Okay, disgust. I'm answering disgust. Correct.
Contempt.
Contempt.
I don't know the meaning of contempt.
Even I don't.
Contempt is like you don't
This is
agree.
disgust.
You don't agree, but you're not verbally saying that I don't agree, but internally you are saying I don't care. Contempt of court, more like insult. Yeah, offending. This is anger, pain, disgust, sadness.
Disgust.
Disgust.
Oh, disgust. Looks like disgust, yes. Correct. Desire, embarrassment,
Flirtatiousness.
Flirtatious.
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 Okay, I submit flirtatiousness. Correct. Shame, anger,
Shame.
pain.
Shame.
Shame,
It could
Sadness.
be
shame or pain?
Sadness.
Pain,
Okay,
I think.
Shame or pain?
Pain, pain.
Pain. Shame.
Shame.
Correct. Okay, compassion, sadness, anger, interest.
This is sadness.
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 Sadness. Correct. Oh,
Compassion.
compassion.
Hmm.
Amusement, desire, surprise, excitement.
Amusement.
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 Amusement. Looks like amusement, yeah. Correct, yeah. Surprise, interest, desire, happiness.
Surprise.
Surprise.
Interest. Interest.
Surprise.
Interest.
Interest.
Okay, I go with you. Let's see. Correct.
Interest.
Sadness, shame, disgust, compassion.
Sadness.
Sadness.
But very artificial sadness. No? Correct. Disgust, love, contempt, desire.
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 That's a very regular gesture they show. Although I don't know how many.
Actually, we have that expression.
Yeah, how many really? Yeah. Sadness, pride, embarrassment, shame.
Sadness.
Shame.
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 Yeah, looks like shame.
Shame.
Shame. Yeah. Happiness, desire, politeness, compassion.
Politeness.
Politeness.
Looks like politeness, yeah. Sadness, shame, embarrassment, love.
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 Embarrassment.
It's love.
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 It's love.
How many boys would actually express love like this?
Embarrassment.
Embarrassment.
That was
It's
embarrassing.
embarrassing.
Embarrassment.
Guilt, sadness, pain,
Okay.
disgust.
Guilt.
पेन लग रहा है यार.
Pain.
Pain.
पेन लग रहा है.
Guilt.
पेन करो, guilt करो, बोलो.
Pain.
Pain.
Pain, yeah.
Okay.
Last question.
Satisfaction.
Satisfaction.
Okay.
Love.
Love.
So I hope it gave you some idea about how we sometimes fail to notice the facial expressions and how important they are. Because if you are able to observe, we don't normally look at expressions and try to read them, but it's a good idea. I think one of the bases of emotional intelligence is being able to read emotions. And leveraging emotional intelligence in healthcare is very, very important. I think that is something we really need to work. Eye contact. Is eye contact important?
Yes.
Very.
Very important.
Yes.
How will eye
But
contact
for how
help?
long?
Yeah, that's important. But how will eye contact help? Write in the chat box. Write in the chat box so that everybody gets a chance to. Reflects honesty and sincerity. Very right. We are interested to listen. Yes, you are interested to listen. That can be shown by, it says you are attentive, helps to make a connect. Wonderful. To build up rapport with the patient, develops trust, supports communication, helps to immediately connect, shows empathy. Wonderful. I think, see, so many answers you have given. And eye contact is one thing that we at times fail to make. What a golden opportunity to build rapport with anybody, to just by making eye contact with the patient, showing that you are listening. Yes, attentive listening, and it reflects our interest. Very true. I think first thing that we need to train our staff is the moment patient or anybody comes into a visual field, put whatever you're doing on hold and look at the person. Prompt attention is something that really patients look forward to. I'm not saying leave what you're doing and attend to that person. Maybe what you're doing is very important. But if you look at the person, and even if you say, just 1 second, let me finish this. Or can you please wait for a second? That's also good enough. But making eye contact and making the other person feel that, yes, I can see you. Because when we don't look at the person, we are in a way negating the existence of that person in our visual field. And that's very insulting. You can recollect your student time when you went to your professor's room, you were waiting outside their room, they can see you standing there, but they would not acknowledge your presence. They'll make you wait for hours together. How did you feel? Exactly, this is what patients and their family members feel when we don't look at them, we don't make eye contact. For example, in this picture, you can see she's busy on phone, the lady is looking at her, but she's not paying any attention. You could continue on the phone, or maybe say for a second, hold on, and tell to the person, let me complete this phone call, I'll attend to you, please take your seat. That's all. It won't take more than 5 seconds, but the person will feel very satisfied that I have been promptly attended. The protocol of eye contact is, I've shown 2 pictures in this. In a personal relationship, you can look below the eyes. In a professional relationship, it's always good to look above the eyes. Even when you are into training and when you're into initial training, look above the eyes, you will feel less scared and less anxious. I know because some of you will be starting your training, venture now. So when you are training and you feel uncomfortable and little anxious, look above the eyes. You'll feel less uncomfortable. Rather, we always say above the eyes, on the forehead. And in a personal relationship, yes, you can look below the eyes. You can look at the face and the lips and the nose. But in a professional setup, the socially acceptable glance is look at the person for 2 to 3 seconds, shift your focus, and then look back. Do not stare, because when you are continuously looking, the person might feel uncomfortable. They may feel being challenged. And if especially we don't have any expression on the face, they may feel that we are not agreeing or we are refuting what they are saying. And looking from head to toe is not advisable. That's not a good idea in a professional setup. Posture. You can see two postures in this, A and B. Which one do you think is okay?
B.
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 I would say A.
Some more answers? I want everybody to participate.
For A, posture shows disinterest, and the second posture is like disconnection. B posture.
I think both are not right.
Yes, both are not right. In A, the person appears very casual. In the B, the person appears very closed. So the right way of connecting is, especially with
leaning
patients,
forward.
and leaning forward. When you lean forward, when you nod, that shows that you are interacting, you're attentively listening. In public place, it's very important to be mindful of the way we stand and we sit. I've seen in a number of places, residents will be sitting on the table and chit-chatting. Or, nurses would be standing together and, laughing or talking. We need to be really very, mindful of the way we conduct. Even like on a front desk staff, I see sometimes they would gather and, start discussing something. It looks very unprofessional. So in a public place, we have to be very mindful of the way we stand or way we sit. In personal life, we can do whatever you want, but at a professional place, it's very important to be mindful of the way we stand and sit. Whom does he look like? The trust is built on the way we appear. So had I been wearing some funky dress and have started your session, probably you would doubt what is she going to really do if she herself is looking so funky. And we should take advantage of this, that the first impressions are formed from our appearance. I was taking a session for a group of judges. So they were young judges being inducted. And before my session, there was a very senior judge, retired lady judge, who was talking about the conduct in a public place and the way you should dress up. She was having a hard time explaining to these budding judges that you need to really dress gracefully in public for the decorum of your profession. They were literally arguing and, being aggressively, arguing with the professor that, why the hell should we be wearing, such dresses? So my message to the doctors when I talk to them, see, please remember, you will be treated the way you dress up. If you look like a doctor, people will treat you like a doctor. At times, young nurses, young doctors come and tell me, especially girls, they'll say, ma'am, since I work with the medical students, so they'll come and say me, ma'am, sometimes the patient will call us sister. I am a doctor and the patient is calling me like a sister. I have earned this degree with so much of this thing and the patient is calling me sister. If you don't want to be called like a sister, then you need to dress up like a doctor. So emphasizing on the right dressing is very important. Wear comfortable clothes, colors that are suitable to your profession. In personal life, I tell them, I say, wear whatever you want in your personal life. Please remember, don't put it on the social media, because there will be people who would be watching you. And then if you don't care, then be ready for the consequences. So you can get immediate respect if you're dressed up properly. Why not take advantage of it? It's your call. Even the colors that we choose to wear, you have to do it carefully. All bright jazz and floral print and those things, please avoid at a public place, especially in the healthcare, because patients are suffering. They feel a kind of disconnect between them and us if we are very jazzily dressed up. They feel that we are not affected by their suffering and their pain. So it's advisable to wear colors and dresses that look fine with the kind of profession you are into. Touch, a very important way to communicate. So what kind of touch have you experienced, in case if you have been in a patient's chair anytime? Can you recollect any incident where you felt uncomfortable? It's not only about being touched by an opposite sex, if you're a female patient and a male therapist, or the vice versa, but otherwise. And can you recollect any incident where you felt uncomfortable about the way you were touched? Not able to recollect? But a lot of time patients, come back complaining about the rough touch they have experienced. Touch is something that's not avoidable, because we need to just touch the patient for examining or for treating or for doing anything, but we have to touch the patient with care and respect. Especially young adults, female patients, they feel extremely uncomfortable if they are not informed about the touch and if they are not touched in a respectful manner. I remember in one of the hospitals, ECG technician, he did a ECG for a lady. This lady went out after the ECG and she went and said something to her husband. And her husband literally came killing this ECG technician. How dare you touch my wife? Because normally we know in ECG we have male technicians. I haven't seen many female technicians doing ECG. But we don't inform the patient. We don't take permission. We don't let them know that I'm going to do the ECG, and also they don't know what is the procedure you are going to follow. So it's always advisable to have a female attendant or a family attendant with the patient so that they feel comfortable and safe. And of course, when you are touching them, we should remember that we have to touch them with respect and care. Of course, touch can communicate empathy, understanding, and power. But we need to be really mindful of the way we touch. Soft touch on the shoulder or on the head or on hand goes a long, long way communicating care, compassion, empathy. But care has to be taken. If it's a female patient and male therapist, I would say avoid this, because unless you have really built a wonderful rapport with the patient and the family and they trust your intention, it can cause confusion. So it's better to avoid such gestures. Hand movements. So what kind of hand movements you think are inappropriate? Can you recollect some hand movements that you have seen people doing? Anybody? Okay. चुप हो जाओ, ज़्यादा मत बोलो, है ना? That's very often. Yes. Wait. रुको, रुक जाओ. Very true. So again, hand movements can be a very big, bone of contention with some people, especially if it is not used mindfully. And we communicate a lot. चलिए बाहर, बाहर चलो. So what we are saying, we are trying to shoo the person. So we need to be careful when we are using hand movements. So when you make hand movements like this, that shows that I don't care, or what can I do? That's your problem. That's not my problem. Or when you say something like this, wait, or hold on, or go away. Again, it's very pointing to the part of the body which is sick is also something we do sometimes. It can be very uncomfortable experience for the patient, especially if it is to the private part of the body. So we got to be careful, making such hands. We all carry a bubble around us. We like that bubble to be respected. So even patients want that bubble to be respected. We really need to make sure that we maintain safe distance unless it is in need of the procedure. So a 2.5 feet distance is good, because that's where patient will feel comfortable. In case you need to go closer, Inform the patient, let them know, I'm going to, examine, your back or front or your mouth or your eyes, and then go closer. Respecting patients' privacy and confidentiality is also part of our interpersonal skills that we need to remember. A lot of time, we don't care much for the patient's privacy, and we talk about patient's problem in a group like this, and you can see the kind of expression people are giving looking at her, and how she must be uncomfortable being hoarded by so many people around us. We make the patients wait for hours together, clearly indicating that I don't care for your time. We make them come again. We make them, we don't try to cut down on their waiting time or their, number of visits. That clearly shows that we don't value their time. And that's very upsetting to the patient and their family members. So we have to, literally do the process mapping of the way we are functioning and see where all we can cut down on the waiting time and also the number of visits of the patient. I think that's one of the good ways to, make the patient feel that we value your time. So ultimately, display of respect and care at every point of contact, right from the beginning where the patient's family park their car, to the point where they come for, registration at the front desk staff, and then to the OPD, and then to the radiology lab, pharmacy, wherever patient goes. I think each and every one of us need to be sensitive to the idea of being respectful with the patient. So sometimes these behaviors we do unknowingly, and they clearly show that we don't care. For example, when they're talking to us, we start looking away, or we start staring at them. We look sarcastically, close our eyes, you use unpleasant tone, start playing with the phone or busy doing something. That clearly shows that we're not interested in interacting with you. I think one thumb rule that we can all practice is don't give the behavior that you don't like to receive. If you were at the receiving end, and if you were given this behavior, how would you really like it? If you will not like it, so is the patient. So we need to be mindful of this fact. So communication is incomplete without active listening and feedback. This we have talked about language, paralanguage, body language, and a number of other things. But two important things that completes the communication is active listening and feedback. And if you remember, we did an activity on active listening. I will not do this activity because we are left with just 10-15 minutes and I have a couple of things to cover. But if you look at that exercise that we did last time on Chinese whisper, that shows we think we are listening, but we are not listening. So attentive listening is something that we have to mindfully inculcate. It's very easy to get distracted. So there are many types of listener. There are people who will pretend that they are listening. You will see when the patient is talking, we pretend that we are listening, but we're actually busy doing something. Some of us outrightly demonstrate, I don't care to listen, especially when we are in authority position. It's visible from our facial expressions, body language, that I'm not listening to you and I'm not interested in listening to you. Some of us are in hurry to answer. And you may have seen, sometimes we don't let the other person complete and we try to reply to that. There are very few who actually listen to answer. There's a statement, we listen to answer and not to understand. So it's very important to change this practice and really learn the right way of listening. So these are all different levels of listening that we all practice. One could be just completely ignoring, right on the face. Second could be being a little more polite, pretending that I'm listening but actually not listening. Third could be selective listening, thinking the patient talks a lot and I don't need to listen to everything, so I just need to focus on what is related to the illness. But these are all not the right ways of listening. Ignoring, pretending, and selective listening are not the right ways in healthcare. The correct way of practicing listening is attentive listening. When the patient is speaking, please listen carefully. Reflective listening, where you actually kind of rephrase what patient has said, where you showcase what I have understood. And empathic listening, where you are not only listening to the content, but you're also trying to understand the emotions and the feelings. And that's the highest level of listening we need to demonstrate with the patient. So the right way of communicating with the patient or the listening is listen to the patient, confirm. If patient has said something, please repeat and ask, Am I understanding you right? So you will be able to better confirm what the patient has said.
Paraphrase.
Yeah, paraphrasing, correct. Then understand their concern, because that requires little comprehension and working and processing, and then respond. That will be the right way of listening and practicing attentive listening. So it's not only important to listen attentively, it's equally important to demonstrate that yes, I'm listening to you. So what all are the ways to demonstrate that I'm listening to you? Write in the chat box, please. What are the different ways that you can demonstrate that you are listening? Lean forward, nodding, yes, very right. Like Amreen, you wrote eye contact earlier, but that makes sense. Definitely nodding the head, yes. Eye contact, nodding the head. Look at the speaker, very right, very true. What more? Repeating at the end of the confirm, yes. Rephrasing, or yeah, very right. I think most of you have written the right thing. Yes, open body posture. That shows that yes, I'm listening to you. Saying, okay, next, yes, I got it. Short, yes, that is facilitating to what we are saying. Very right, Sherbano, very right. Responding, yes. Asking question, correct. Very right. So that means it's important to first of all face the person to show that yes, I'm listening to you. Making adequate eye contact. Smile if appropriate. If the issue is not very serious and you think you can smile, it's always a good idea to have a smile on your face. Put things on hold. You may be doing something, if momentarily you can put things on hold, they'll feel being attended. Lean forward to communicate interest. Do not do multitasking. So when they are talking and when you are talking, don't simultaneously keep writing something on the register or entering something on the computer. Put that on hold for a second and listen to the person. Nod to communicate that yes, I'm listening to you, I'm understanding, and I'm agreeing. So a lot of time at this point, when especially when you say don't do multitasking, doctors may tell you that we have a laptop in front of us where we need to simultaneously add patients information, because in a lot of hospitals we have this practice already on, where we are simultaneously adding information on the computer. So there they have to be really sensitized to the idea that it's like having a third person in the room, but you got to make adequate eye contact in between. Maybe when the patient is talking about something very important, put your typing on the hold, look at the patient. Also, if you can inform the patient, I will be adding your information simultaneously. So it's all about you. I'm doing it so that I don't forget, so that I don't miss on anything. Is that all right? Are you okay with this? 99% patient will say it's okay. But the moment they'll get to know that there's a reason why this doctor is simultaneously typing, and that's for my benefit. And also they'll say that you have taken permission. So taking permission is not actually permission, but then they feel empowered that I have been, sought permission. So that's the way to, do multitasking in a manner that does not disturb the flow of the information, but you are able to do the things in the right manner. So in between nodding to communicate, yes, I'm listening, I'm agreeing. Even if when you're typing, they get an idea, okay, they are being heard. So when they are talking, it's good idea to avoid interrupting. Even if you have to ask something, put that on hold for a second. Ask that question to clarify after the patient has finished, and one should not interrupt the patient. So this is again to emphasize on the active listening protocol. Couple of things that we have to remember. First is pay attention. Second is we have a tendency to start judging the person. Oh, this person talks a lot. Or this person has nothing to say. Or what he's saying is just useless. So we have to stop judging the person. We need to have patience to allow the person to complete. Don't be in hurry to interrupt or to complete the answer or ask another question. Be mindful of your body language, because you are communicating interest or disinterest through your body language. Restating is a very good way to confirm whether you're on the same page with your patient. And in case if there is something that you need to ask, always ask it. That also shows that you are listening and you are understanding. And in case if you're not understanding, you are checking that. So communication is about shared meaning between two people. So both of them need to be on the same page. A very important thing that we have to remember when we say something to the patient, how to confirm that the patient has understood. How do you confirm whether the patient has really understood? For example, you have explained about the discharge slip, or you have explained about the medication, or you have explained the patient about the intervention. So how do you confirm whether the patient has really understood whatever you have explained?
Feedback.
Asking the patient to repeat.
Wow, very good. It's very important to check their perception. And one of the good ways to check is teach back technique. It's a wonderful way to confirm if the person has really understood. I've explained you everything. Can you tell me in your words, what have you understood? I'm sure at home you're going to have a discussion about what we discussed here. Can you tell me what you're going to share with them? You will get an idea how much have they really understood. I think this is one thing we have to really, integrate with our communication, because we don't use this very often. I think you will agree with me. But teach back is a wonderful way to confirm whether we are on the same page. In case if there are any lapses in communication, you will be able to correct them right then and there itself. Suppose if it is about medicine, the person has not understood. The person is going to take medicine at the wrong time, or in the wrong dose, or in the wrong manner, or there can be medication errors of any kind. And I tell my students, you write discharge slip for your patient and you explain to your patient, just ask them to do teach back. Trust me, they will not be able to repeat more than 20 to 30% of what you have explained to them. And you can try this even in your setup. So teach back is the best way to confirm if the patient has really understood. So I have 2 videos to show you. I think I'll show them immediately so that we can. So these 2 videos, maybe some of you have already seen them. They are about bad consultation and good consultation. Although they are made on doctors, but then I'm sure these can be used to show people how our verbal and non-verbal behavior can, influence the quality of interaction that we have with our patient. Give me a second to show you the bad consultation. Okay. Some of you may have seen it. They are Dr. Kingsley and Dr. Badri. But they are wonderful video done by both of them. Excellent work.
Next. What? Doctor, my leg is swollen and painful. Since when? For the last 5-6 days. What were you doing? Why did you wait so long? This looks pretty bad. Doctor, I thought the pain was just a strain in the leg. Anyway, what do you think now? You could have waited for some more time and we could have amputated your leg. Leave it. What's your sugar level? It is under control, doctor. The fasting was 140. When was it done? What was your HbA1c? It was 4-5 months ago. Actually, HbA1c is a expensive test and I was feeling all right. I can't understand. You do investigation according to your will, you don't take proper treatment, you don't follow our advice. I don't know why you need doctors and you come up with all sorts of complications like this. And what did you do with your leg? I went on a pilgrimage to Sabrimala, so had to walk barefoot. I might have injured, I think. Barefoot? Hello? Yeah. Who? The patient Ram, HIV positive patient. So he doesn't want CT scan. So tell him if he wants treatment, he needs to undergo CT scan. Like, what does he think of himself, yeah? Prime Minister or President? See, discharge him against medical advice and tell him not to come to this hospital once again. Okay? Yeah, bye. And you got this boon. I'll tell you, if you go once again, you will also go near the God. Didn't I tell you about the foot care when you came last time? And your smoking is continuing without interruption, I guess. I have reduced a lot, doctor. I am smoking only 1 or 2 cigarettes a day now. Can't understand your attitude here. You do smoking, you are overweight, you don't take medications, you don't do investigations. I don't know what to tell you. I'm trying, doctor. And if you don't want to see me, I could consult someone else. See, whatever I'm telling is for your good. I don't know how to tell. I gave you information leaflets last time and you're not following my advice. And if you don't want to see me, it's fine with me. I have got enough work to do. I've got enough patients to see. Sister, please call the next patient.
So, since we have discussed communication competency at length, what all could you observe in this video that was not appropriate? Write in the chat box. Sarcastic remarks, no empathy, insensitive behavior, rude, completely agree, no active listening when the patient entered, okay, did not pay attention, very right. Words, body language, everything was rude, wonderful, no smile, no proper eye contact, no warmth in the tone, rudeness, agreed. Not having good communication, correct. Not looking at the patient during initial talk, agreed, yes, correct. Did you see that he talked about the other patient in a very rude manner? A doctor
Breach
who
of
does not.
confidentiality.
Yes, breach of confidentiality, very right. Sharing other patients' information, very right, yeah. A doctor who does not want that patient become okay is a willingness person and do not value patient, okay. Talking about other patient, yes. And also, he made mockery of somebody's religious beliefs. When he talked about, you went to Sabrimala, so next time you go to Sabrimala, you will go directly up. So I think we could see the whole. Do you think at the end the doctor or the patient would have been really happy? And imagine the same doctor would be seeing, say, 30, 40, 50 patients. If this is the behavior you have with each patient, and at the end of the day, how are you going to really feel? Exhausted, drained. Because every interaction is an exchange of energy. And if your exchange of energy is negative, you are giving negative energy and you're getting back negative energy. So that was one patient with whom you behaved rude. He went back dissatisfied. But you have done it with 40, 50 people and your staff and your team member and all others. So imagine the negative energy you're receiving from all of them, and how that's going to affect your physical, mental, and emotional health. I think that's something we really need to emphasize to help them see that why it is important to be cordial with the patient. Now, let me quickly show you the second video. Could the whole interaction be in this manner?
Next. Hello, Mr. Kannan. How are you? Please take your seat. Thank you. What can I do for you?
Doctor, I think I have a problem with my leg.
What happened?
4-5 days back, I went to Sabrimala and I had to walk barefoot for some distance.
Mm-hmm.
I'm very scared now because my leg is swollen and painful in the last 4-5 days, and I think I did a stupid thing by walking barefoot.
Let's see what we can do. Good that you realize the importance of foot care. Meanwhile, how are your sugars?
Actually, my fasting sugars was 140, but it was some months ago. I was feeling all right and I didn't do the HbA1c. It is so expensive, you know.
It is expensive indeed, but it is so important to get the investigations prescribed by the doctors, because otherwise it's very difficult to give the treatment, you know, and treatment may not work as well. Anyway, can I examine your leg?
Yeah, sure. Sorry, sir. It was my mistake. I didn't do the test.
Hello? Yeah? Yeah. Excuse me for a moment. Yeah. What's the name of the patient? Mm-hmm. So he doesn't want the CT scan, right? Yeah. Try to explain to him the importance of CT scan. Yeah. When I come for rounds, I will also tell him. Okay. Thanks for informing. Thanks. Bye. Sorry about that. You got infection in your leg. So how are we doing regarding the quitting the smoking?
Regarding smoking, it's doing good. Actually, I brought it down to only 1 or 2 cigarettes per day now, doctor.
Oh, that's good. But total quitting is very important. See, if you have reduced from 1 pack to 1 or 2 cigarettes per day, quitting that is also not very difficult, you know. And how are we doing regarding the exercise?
Yeah, going on, but I must admit not so regular.
See, exercise and diet are as important as your medicines, if not more. But for the time being, you need admission for sugar control and control of this infection. Is it okay with you?
Whatever you say, doctor, you have to cure me this time, and hereafter I will definitely take care of myself. This will not happen again.
Yeah, we need to control your sugars and control the infection, otherwise it may go for gangrene and may lead to further complications. Now the sister will go through the procedure and admission process. Okay, and meanwhile you have this leaflet and you can go through it, which will help you to follow the regimes. Okay, thank you very much.
Thank you so much, doctor. It was so kind of you.
You're welcome. Thank you.
Is it very difficult? So it may appear a little artificial to some of us because that's not the way we normally, interact with the patient. But a part of it, if could be implemented, I think the patient satisfaction and professional satisfaction of all of us will definitely go much higher. Do you agree with me?
Yes.
And if you look at the length of both the videos, the second video took shorter time. There was more qualitative interaction, fruitful interaction. meaningful interaction. Both the doctor and the patient went satisfied. There was no ill will created between the two of them. So even if the patient was not following the regime, becoming aggressive and annoyed with the patient is not the way that's going to help us. Patient compliance is 33% across the world. So don't be disappointed if your patients do not, follow the treatment regime very meticulously. Your role ends when you explain them the purpose of following the regime in a proper meticulous manner. Put the ball in their court, let them know the consequences, not in a threatening manner, but in a manner that helps them understand the importance of following the treatment or follow-up or medication. Let them know the consequences in a matter-of-fact manner rather than threatening and accusing them of ignorance and lack of knowledge. Again, that's a mindful process. So if my patient is not following the treatment, I can say, I completely understand it's very difficult to control sugar, but I must tell you that with this high sugar, there's a risk of having very severe infection, especially if you injure your foot. The injury can be so grievous that it can, be very dangerous for you and for your, not like fighting or arguing or being annoyed with the patient. That's something we have to really learn mindfully. So it's already 10 minutes over and above the time, and I have a couple of more things to discuss. Is it okay if I break the session here and whatever is left we cover in the next session? Is that okay?
Sure.
Because
Yes,
then I would be
Yes.
doing it in a hurried manner, which I don't want. And for all of you, it is very late. I know it's already 10:10. You all must be very tired. So during this session, please feel free to have a cup of tea, coffee, juice, whatever you want to have to keep yourself, comfortable and active. I mean, there's no problem if you're taking tea or coffee or anything during this session. I have no problem with that. Look after yourself. That's it. So I will share the feedback for this feedback link in the chat box. I request all of you to give your feedback about whatever we have covered. I hope I have the, no, I need to get the feedback. Give me 1 second to get the. Yeah, I've shared the feedback form, so please check if it's working. Could someone confirm it is functional? The link is functional?
Yes, ma'am.
It is, ma'am. Yes.
Thank you. And meanwhile, if anybody has a question or a remark to make or a feedback, verbal feedback that you wish to give. After you have done it, you can write done in the chat box so that I know who all have finished the feedback form. Sharbanu, I have reshared the form in the chat box.
Can I ask a question, ma'am?
Please.
Isn't teach back a lengthy form? Like, isn't it more time consuming as a practice to have?
So again, the amount of benefit, if you consider through teach back, especially the salient things, and especially when you know you have shared something very important, and that should go as it is.
Right.
For example, if I've talked about some serious diagnosis with the patient, or poor prognosis, or the cost factor, or the deterioration in the condition, usually the violence in the healthcare happens when we haven't done this activity in the right way.
Right.
And if you invest, it's a matter of just a minute or two, that's all. If it has been a very simple kind of interaction, for example, a patient has come for a GIT problem or UTI problem, there's not much to be done. Maybe you just say, okay, have you understood the medicine? So the patient might tell you, okay, I have to, because you know what I have to focus on.
Right.
But not asking anything, again, you're taking a huge risk. So I was taking a session for a group of neurologists. So one of them said, one day a patient's father came to me asking, that child had seizures. So he was put on serepeptine. So in the follow-up visit, the father asked me, sir, how many bottles do I have to take of this medicine? He said, what do you mean by bottles? He said, so you have written 100 ml BD. And if I may share with all of you, although I normally never share, this is the first time I'm sharing because you've asked a very pertinent question about the importance of teach back. I lost my mother because of this. She underwent cardiac surgery, was doing very well. But she was not told about one particular medicine that she was not supposed to stop at any cost. She didn't know the importance of that medicine. On her own, she decided, I've taken this for so long. After stopping the medicine, after 1.5 or 2 months, she had stroke. She was on bed for 3 months and we lost her. And later on, we got to know that she had stopped taking one medicine, which she didn't know that it was so important for her. I've never shared on any platform, but because you asked it,
Ma'am, thank you so much for sharing that. Actually, that's really a painful experience.
see, we have to take healthcare very seriously. We are dealing with life and death. A small error here and there, it's all right. But in healthcare, it can cost us a life. Any other question or feedback or remark from any one of you? More than happy to take it.
I do not have any questions, but then this being my first session, it was a wonderful session. Listening to you, quite a few of those concepts we have even in our managerial communication, but the perspective you have shared with respect to healthcare is as a patient or as a visitor to a hospital, the other side, yeah, I am familiar. So this actually helps, or should I say brings more clarity. So thank you very much.
Thank you so much for the feedback. I think that gives me a lot of confidence in the work that I'm doing. And that's the purpose of these programs that, and trust me, most of it is customized by me, keeping in mind the healthcare scenario of our country. Even the book that I have written, I've spent almost like 2 years writing that book. I didn't copy paste it from any place. I read a lot of material, but then I wrote it what will fit in my country with my fellow professionals. And I think that's what is making sense with people, and they're liking the content. So this program also I have designed based on what will fit in our country, with our audience, with our trainers. And I'm really looking forward to have people who have thorough knowledge of this subject and can actually make a difference in the healthcare delivery.
Ma'am, this book, this will be included in the curriculum of medic MBBS and PG, or?
हिंदी में एक शब्द कहते हैं, आपके मुंह में घी शक्कर. I don't know. I've done my job.
It should be, ma'am. It should be.
I have done my job. I always, this is my conversation with the God. When I do my work, I tell him, I've done my job. This is your job. Whether this book is received, liked, unliked, taken, bought, not bought, I don't care. My job was to do it in the best possible manner that I could do. And I've done.
Great job, ma'am.
Thank you.
Very much required and essential.
Ma'am, I tried to get the book, but it is out of stock in many places actually.
I will send you another link in the group if you want. That's the direct distributors link. I think they were also directly sending it.
I have purchased it very online helpful, please. From.
Yes. I tried and I didn't get it. So
even I have done that, ma'am.
Okay,
from the direct link.
Direct link, yeah.
It would be good to have a link, yes.
Yeah. So, Dr. Shefaz, any feedback from your side, because you are from a different place. So, how are we? Are we on the same page? Are you finding it meaningful? Whatever we are discussing, am I able to address your concerns? I need to know from your input and Dr. Sherbano's.
Yes, ma'am. Our cultures are very near, but in Afghanistan, as it's a war country, people are very irritated and they are near to fight. So it is very important for every health professional to follow these classes. It was very beneficial.
Thank you so much. So in the future sessions, we are going to spend a lot of time understanding how do you address patients' complaints and how do you manage them, and how do you handle uncooperative patient, how do you handle aggressive patient party, how do you go about breaking the bad news in the right manner so that you can avoid any kind of aggression in the workplace. So I hope those sessions will definitely help you in spreading the right way of handling situations to your healthcare.
Thank you so much.
Thank you. Dr. Kunal, you wanted to say something.
Just two small things while observing the how you were conducting this program. One is the pauses that you take while just before sharing an important data, maybe a number, say, so that was quite important. It gave more importance to, or it brought the attention of the audience, like from us, of what would be coming next, like how many percentage is verbal and how many percentage is non-verbal. As well as your pauses just before asking a question, or just after asking a question, where you don't intend the audience to answer, but to feel. For example, you asked, how would you feel in such a situation? And then there was a pause where we have to reflect and we feel. We don't necessarily have to answer. So that was one thing that I learned. And another thing is that if the base of the program is set well, then we can pick up the pace towards the end and finish it on time. These are the two things that I learned observing today. Thank you.
Thank you so much for your feedback. For future sessions, I would request everybody to please be on time. Although I understand you all are working professionals, and 8 to 10 is a very late hours for all of you. But I think you don't get anything easily. It's always through some hard work, some sacrifices, some efforts that you will ultimately be benefited. Try to be, try to log in 5 minutes to 8 so that we can start sharp at it. Normally I log in 15 minutes before 8 o'clock so that, you can all, comfortably join in. Try logging in on time so that we end on time. But I don't really, insist on this. I insist more on your learning. 10 minutes here, 10 minutes there is fine. If you are liking it, if you're finding it meaningful, that's worth all the effort that we are making. And all of you are doing a wonderful job by being a very interactive, serious participants. That's what motivates me to give my best. And trust me, even if I've done this session 100 times, Anuradha knows that this is one topic that I have been, doing a couple of times. But every time you will find my content will be revised and different from the previous session. I hope, Anuradha, you will agree with me. Even for this session, I must have spent almost like 3 to 4 hours revising, keeping all of you in mind, from where you are coming, how are you going to use it, will it really benefit you? And I have to keep everybody in mind, right from the person who is very new and to the person who is very experienced, like Dr. Tanu and many more of you, who are already seasoned trainers in your own field. But I try to, keep that range in my mind and make the program interesting. Thank you so much for your feedback. I'll take care in future. We stick to the timeline and not over spill it, and all of you please be on time. Dr. Anuradha, you want to say something, and that's the last comment, and then we end it. Thank you so much.
It's not a question for you. It's a question from our colleague from Afghanistan on a lighter side. So when you showed some faces, she chose the face number 2. I just wanted to ask her, the healthcare professionals from Afghanistan, how are they at the face number 2? It was very happy. And it's little difficult, different from Indian side. So you can answer in the next class also, since, it's time. But then I was really, curious to know this.
Yes, I think everybody was very surprised to that I have chosen the second picture. In my hospital, most of us are in very smiley face. And that's why we have lots of patients. Today in Kabul, we had snowy weather. Despite that, we had 50 patients, while the other doctors may not have even 5 patients. So I trained them not in a professional way, but as somebody has this feeling or this feeling to satisfy the patients. So I train my staff. Most of them are very good.
Oh, good. So we can applaud for you and your team. Wonderful.
Thank you so much.
Thank you for sharing. Yeah.
We all work with Dr. Shufajud, and even sometimes that we don't know a patient, then we talk with that patient and say, oh, how are you? Where were you these times? And we behave like them, so much close and friendly. Even though when Dr. Shufajud and us, we have a lunch, she used to give lunch for the patients, give tea for them. And we have a box that it has a chocolate, lollipop, and bubbles for the babies of the patients and women. We gift for them just for becoming happy. And all of us just we used to always we have a smile on our face.
Wow. So we have to learn from both of you. Wonderful. Thank you for being. Thank you.
You are welcome, ma'am.
Thank you so much. So I think with this, we come to the end of the program. I know you are all very excited to have the discussion going on. I can have it because it's 12 o'clock noon for me. So for me, it's not a problem, but you all must be very tired and you have a long day to go. So we meet next Tuesday. So as of now, I'm keeping it only once a week, but maybe a little later we'll have twice a week. Is that okay with everyone?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
And just one request, try applying whatever you are learning from this session. One is revise.
That's important.
We forget 80% of what we learn within 24 hours. How much ever interesting it is, you are likely to forget. So if you are making notes, and especially I'm sharing the YouTube video with you, look at the video, make your notes, go through your notes, and try applying it. And whatever challenge you experience, share it in the next class. We can discuss it. That will be the true, implementation of what we are learning. So thank you so much, everyone.
Thank you.
Thank you,
Thank
ma'am.
you.
Thank you.
Thank you.
Good night,
Thank you,
everyone.
ma'am.
Thank you.
Thank you, ma'am.
Bye-bye.
Bye. Good night,
Good
everyone.
night, everyone.
Bye.